Washington, after months away from the campaign trail, U.S. President Donald Trump plans to rally his supporters this coming Saturday for the first time since most of the country was shuttered by the coronavirus. Trump will head to Tulsa, Oklahoma, a state that has seen relatively few COVID-19 cases. But health experts question the decision, citing the danger of infection spreading among the crowd and sparking outbreaks when people return to their homes. The Trump campaign itself acknowledges the risk and has tried to protect itself from lawsuits with waiver language on its registration website. By attending the rally, you and any guests voluntarily assume all risks related to exposure to COVID-19 and agree not to hold Donald J. Trump for President Incorporated, liable for illness or injury, the campaign advises those signing up for the rally. Advertisement. It comes as part of the U.S. record spikes in new coronavirus cases and hospitalizations. Alabama reported a record number of new cases for the fourth day in a row on Sunday. Alaska, Arizona, Arkansas, California, Florida, North Carolina, Oklahoma and South Carolina all had record numbers of new cases in the past 3 days. Medical workers test Boston residents for coronavirus at a drive-through clinic. Credit. AP. Many state health officials partly attribute the increase to gatherings over the Memorial Day holiday weekend in late May. Trump's rally will be held indoors, at a 19,000-seat arena that has cancelled all other events to the end of July. Scientists believe the virus spreads far more easily in crowded enclosed spaces than it does outdoors, where circulating air has a better chance of dispersing virus particles. An extraordinarily dangerous move. Trump's rallies typically draw tens of thousands of supporters. They usually stand outside in line for hours before passing through airport-style security and cramming into an arena, where they sit side by side or stand shoulder to shoulder. Some die-hard fans travel across the country from rally to rally like groupies for a band. Dr. Ashish Jha, director of Harvard's Global Health Institute, called the upcoming Trump rally an extraordinarily dangerous move for the people participating and the people who may know them and love them and see them afterwards. I'd feel the same way if Joe Biden were holding a rally. In its final phase of reopening, Oklahoma now allows public gatherings of any size as long as organizers consider social distancing. But in Tulsa, there were 82 new cases reported Saturday, a new high in daily increases for the county. Donald Trump during a rally in North Carolina last year. Bloomberg citing the spike in cases, Bruce Dart, executive director of the Tulsa Health Department, said he wished the rally would be postponed to a later date when the virus isn't as large a concern as it is today. Julie Fisher, an associate research professor of microbiology and immunology at Georgetown University, said the event could have wide repercussions for the country. With a little bad luck, that scenario could end in the seeding of community outbreaks of COVID-19 across the U.S., she said. Protesters gathered outside the Dallas venue where President Donald Trump held a race and policing meeting during a fundraising trip. Credit. AP. The Trump campaign has declined to respond to repeated questions about whether it will require attendees to wear masks, socially distance or take other measures to reduce the risk of virus transmission. Trump has made clear that he believes empty seats are bad optics. I can't imagine a rally where you have every fourth seat full. Every 6 seats are empty for every one that you have full. That wouldn't look too good, he said in April. Why now? Trump has been eager to resume the rallies that are the centerpiece of his campaign. The president revels in his large crowds. The events help his campaign expand its voter databases and will serve as a contrast to Democratic challenger Biden, who has suspended campaign events because of the virus and hasn't attracted the same size of crowds. But the decision to pull the trigger now was driven, in large part, by the mass anti-racism protests that have taken place across the country in the wake of George Floyd's death in Minneapolis. campaign and White House officials say the protests, and the limited public health outcry they generated, gave them cover. If it was okay for tens of thousands of people to march through the streets, demanding racial justice, why can't Trump rally his supporters? 2. U.S. records spike in coronavirus cases nationally. There were over 25,000 new cases reported on Saturday, the highest tally for a Saturday since May 2nd, in part due to a significant increase in testing over the past 6 weeks. Perhaps more troubling for health officials, many of these states are also seeing record hospitalizations, a metric not affected by increased testing. Arkansas, North Carolina, Texas and Utah all had a record number of patients enter hospital on Saturday. In South Carolina, 69% to 77% of hospital beds are occupied, depending on the region. New York, the hardest-hit state, has utilized health guidelines to instruct its reopening and continued to see all measures of infection drop: new cases, deaths, hospitalizations and positive rates among those getting tested. However, Governor Andrew Cuomo warned New York City and Long Island officials on Sunday that their reopenings were at risk if they do not stop further large public gatherings that he said are threatening progress on curbing the spread of the coronavirus. Cuomo said the state has received 25,000 complaints recently of violations of social distancing and other emergency requirements, mostly in Manhattan and the Hamptons, affluent beach communities on the east end of Long Island. AP, Reuters get our morning and evening edition newsletters most viewed in world. Let's block ads. Why?
Show your love for him. Click the link in description. Thanks for watching.